Hi everyone, my name is Julia Wilson and I am a third-year pharmacy student at the University of Connecticut's School of Pharmacy and Pharmaceutical Sciences. Today, I will be walking you through a blog post written by Dr. Jennifer Gerardo, clinical professor. This blog post is titled Empiric Treatment of Pediatric Pneumococcal Infections, Insight from a Recent Study, and is a review of an article published in the Pediatric Infectious Disease Journal in 2025. You can find this blog post on the UConn School of Pharmacy and Pharmaceutical Sciences website under the Pediatric Infectious Diseases and Immunization Update blog series. Before we jump into the study, I would like to take some time to provide a quick overview on pneumococcal infection and the history of the vaccines. Pneumococcal infection can have a range of manifestations, from mild ear infections to pneumonia to invasive infections like meningitis and bacteremia, which can be fatal. These infections can affect patients of all ages, and especially those who are immunocompromised. Luckily, the introduction of the pneumococcal vaccine has greatly reduced its incidence. From the late 1990s to 2023, pneumococcal infection has decreased from 25 per 100,000 patients to less than 10 per 100,000. Over time, researchers have developed broader spectrum vaccines that cover serotypes that used to cause severe disease. Since the original PCV7 vaccine, we have developed PCV13, allowing for coverage of a serotype responsible for severe antibiotic-resistant infections that were not covered by PCV7, as well as PCV15 and 20 that expand coverage even more to protect children against serotypes not included in the PCV13 vaccine. PCV15 and 20 are now the recommended agents for pneumococcal prevention in children. The study that influenced this post was designed by Dr. Kaplan and colleagues and was published in the Pediatric Infectious Disease Journal in November of 2025. They evaluated the serotypes and susceptibility of pneumococcal disease in children. This study was performed across 8 different hospitals in the U.S. from 2018 to 2023. The purpose of their study was to identify which types of pneumococcal infections we see in the hospital despite vaccination. This information will be used to reevaluate empiric and pneumococcal infection treatment strategies and pinpoint areas for targeted stewardship and intervention. At the end of this study, researchers found that breakthrough infections may result in diseases such as pneumonia and mastoiditis. 30% of these cases are caused by serotypes covered by PCV13. Other breakthrough infections not covered by PCV13 include bacteremia, meningitis, peritonitis, and bone joint infections. 23% of these isolates may be covered by the new, broader spectrum PCV15 and 20. What can we as pharmacists take away from this? With breakthrough infections continuing to occur, it is crucial for pharmacists to reinforce the appropriate empiric therapies for the diseases we may see in practice. For non-CNS diseases, the pneumococcal susceptibility data suggests that traditional therapies with amoxicillin or ampicillin, if requiring IV therapy, is likely sufficient treatment. For meningitis or other CNS diseases, vancomycin should continue to be paired with ceftriaxone until susceptibility is determined. As we see the new vaccines that provide broader serotype coverage come into practice, it is essential for us to observe the pneumococcal serotypes our patients are becoming infected with and the resistance patterns that emerge to allow us to drive changes to our empiric regimens. The review article is listed at the top, followed by our other references used in this blog post. Thank you for watching. The full blog post and article can be found by following the link on the screen. If you found this video interesting, please be sure to like, follow, and subscribe to our channel, and check out our blog for more pediatric infectious disease and immunization updates. Have a great rest of your day.